Hi, welcome back to LPHumananatomika. In this session, I will be summarizing all the topics under anatomical terminologies which was discussed in detail in the previous 4 parts. Here I will recap the headings and subheadings of the topics. If you need in-depth explanation of these topics, please go back and watch the previous 4 parts. Okay. So what we discussed under anatomical terminologies is under introduction, we discussed human anatomy, what is anatomy, okay, and what is dissection, what it means, where the terminologies were derived, okay, it is from Greek and Latin. Then we discussed subdivisions of anatomy. So subdivisions of anatomy, you can see we discussed under the subheadings cadaveric anatomy, living anatomy, embryology, histology, what all these subdivisions means, okay, surface anatomy, radiographic and imaging anatomy, what is comparative anatomy, physical anthropology, applied anatomy, experimental anatomy and genetics, right? So we discussed about all these topics under subdivisions of anatomy, and just a brief description of what are they, okay, so that was what it was discussed. Now coming to anatomical nomenclature, we discussed about the brief history of how the nomenclature was derived and how it was approved in different conferences, okay, which occurred in different places, different countries by the anatomists, okay. So that is about anatomical nomenclature. Then parts of the human body, we just recapped what are the different parts of the human body, okay, head and neck, thorax, abdomen, pelvis, then what are the different parts of the upper limb and what are the different parts of the lower limb. Now this is, I told you, just a recap of all the headings and subheadings. If you need the in-depth knowledge or description of these topics, please go back, okay, and watch the previous 4 parts. So this positions of the body, we discussed what is anatomical position, what is supine, prone, lateral position and what is lithotomy position under the positions of the body. Okay, coming to the planes of the body. What we discussed under planes of the body, okay, what is mid-sagittal plane, what is sagittal or parasagittal plane, coronal plane, horizontal plane, oblique plane. So all these were discussed, okay, under the horizontal planes of the body. Okay, the next topic what we discussed was descriptive anatomical terms. Now under descriptive anatomical terms, okay, which is a whole lot of the terminologies, okay, all these were discussed in the descriptive anatomical terms. What is ventral, anterior, posterior, cephalic, caudal, superficial, deep, okay, lateral, medial, superomedial. What do you mean by superolateral, infiromedial, inferolateral, ipsilateral, contralateral, proximal, distal? So all these terminologies were discussed in detail under descriptive anatomical terms. Now coming to descriptive terms related to the body movements, okay, what we discussed was the topics, Okay, so these are the topics what we discussed under the descriptive terms related to body movements. So the main body movements, okay, are grouped under these four main topics, okay, that is gliding movements, angular movements, rotation and special movements. So under gliding movements, we have seen what is gliding movement, and then what are the angular movements, okay, which includes flexion, extension, adduction, abduction, circumduction. Then under rotation, okay, we have seen what is medial rotation, lateral rotation in specific parts of the body. Then the special movements, which is categorized, okay, at a particular joint, okay, which occurs only at particular joints, like pronation and supination, which occurs at the forearm, protraction, retraction, which occurs at temporomandibular joint and also at the scapular region, then inversion and eversion, which occurs at the subtalar joints in the foot. Okay, so these were some of the topics and subtopics which were discussed under the descriptive terms related to body movements. Okay, so coming to clinical anatomy. Now, clinical anatomy, we discussed in the clinical anatomy under naming the diseases with suffixes and also the general terminologies. Okay, so some of the suffixes what we discussed, okay, was the itis, ectomy, otomy, ostomy, okay, and what is oma, and how it can be applied to the specific disease in different parts of the bodies. Okay, general terminologies, which is a whole bunch what we discussed, okay, includes, you can see how many general clinical terminologies we discussed under the clinical anatomy, okay, which is the fourth part of the anatomical terminologies. So I will not go into the details of all these, okay. Please go back and watch the clinical anatomy part of the anatomical terminologies, okay, to know what all these are about. Clear? So these are the different topics and subheadings what we discussed under anatomical terminologies. If you want to download the whole mind map of the anatomical terminologies, you can do it from the link given below or from the Facebook group. Okay, so the link for the Facebook group is given in the description box. Okay, and you can go and download it from there. Okay, thank you. If you like the video, hit the like button. If you have not yet subscribed, subscribe to the channel and hit notification button. Join my private Facebook community where like-minded students will support, discuss, encourage and push each other towards reaching the goal. For link, visit the description area. Thank you for watching.